So my dad always used to tell me when we were out checking cattle growing up that I needed to be able to see sick. I needed to be able to see sick when I was looking at those cattle. And what he meant by that was specifically I needed to be able to look over that herd and tell which ones were sick just by looking over them. I needed to learn all the things that a sick cow would present with so that I could look over however many cattle were in front of me and pick out the ones that needed help. And that concept carried over with me when I went to work in the ER. And during that time, I was an educator, and I used that exact same terminology whenever I was training new nurses. I'd say you have to be able to see sick. Now, the American Heart Association does a much better job of that. In their chain of survival, the very first aspect is early recognition and treatment. So, early recognition is key across the board. So today let's talk about early recognition of cardiac symptoms. Cardiac symptoms, specifically heart symptoms, can be kind of subdivided into two categories. You have men and you have women. Men tend to be very typical in their presentation. They like to do what I call a positive caveman sign. When they walk through the front doors of the ER, they're typically making a fist, they're putting it on their chest, and they're thumping their chest, and they're saying very caveman-esque things like, oh, elephant on chest, oh, grunting a lot, oh, weight on chest, ooh, ooh, ooh. They talk about dull pain. They talk about squeezing pain, just feeling heavy, like they can't get energy. These are all things that they're going to say that make you lean towards more of a cardiac diagnosis. I've actually had patients come to the front door of the ER that spoke no English, but they're giving me that positive caveman sign. They're putting that fist over their chest, saying things in other languages, but just from the grunting and that movement, I was able to tell that it was cardiac, and we were able to get them back and get them treatment. Some things I look for higher levels of concern are sudden onset. Chest pain whenever they are being inactive or they're not doing a whole lot. Chest pain that feels like the chest pain they had in the past when they had a cardiac event. These are all things I'm looking at to tell whether it's cardiac and the severity of cardiac. That is the typical presentation. That is the kind of male presentation of cardiac symptoms. The female presentation is different. I would go as far to say that females do not have heart attacks correctly. They don't do it right. Females are very atypical in their presentation of a cardiac. Two of them that I can think right off the top of my head was one came in for leg pain. The other came in for a little anxiety. And both of them were having active heart attacks. So for this reasoning, most females that come through my ER get an EKG just because they're varied symptoms that can be indicative of a heart attack. They can tell me they have stomach pain, back pain, head pain, dizziness, left hand pain, I don't know. But some things you're going to see on both of them is kind of a left-sided issue. So they might have left arm pain, jaw pain, those kind of things. And it makes sense, heart's on the left side, so, there's that. But for severity, you're looking at those things I was talking about earlier. Those are kind of those, and especially in females, you're going to look in sudden onset, feels like the heart attack I had in the past. I was resting when it happened. These things make you lean more towards it's a severe case. Now, you can have a heart attack after working out real hard, but a lot of times those, I worked out real hard, now my chest kind of hurts, tends to be less severe than I was at rest in my room and all of a sudden it happened. Those tend to be a little more severe. But you always want to look at your patient. Things like a sense of impending doom or situations like that, or the patient saying, I think I'm going to die, or something's just wrong, or all things you want to really keep in mind and act like they are going to. Because it's been a very common occurrence where people come to the front door of the ER and go, I think I'm going to die. And they were right. So whenever they say that, we listen to it. And a motto I like to go for is if you think you're having an issue, act like you are. If you're going to make a mistake, let's make a mistake uphill. If you don't know if you need to call 911 or not, let's call 911. Let's get them going. Because you can't treat cardiac problems at home. You need a hospital to be able to treat them. Now, if you think you're having a cardiac event, first thing you want to do is take 324 of aspirin, chew it up, swallow it so it works faster. But you got to call 911. They're the ones who are going to be able to fix you. There's not a whole lot we can do out in the field. So, if you think you're having cardiac symptoms, if you suspect you're having cardiac symptoms, call 911 and get it going. Learn what these symptoms look like so that you can identify them early and get going the right direction. You just got to be able to see sick.